Edutainment Studios welcomes you to Health Insurance, Knowing Your Options. This module is part 5 of a 6-part series on health insurance. Health insurance can help you stay healthy by paying for all or part of the medical care you need. However, it is easy to feel overwhelmed with today's health insurance options and requirements. There are more types of health insurances to choose from than ever before. All of these choices, along with new laws created to protect you, make choosing a health insurance plan more confusing than ever. At the same time, the health insurance providers are putting more expectations on you to take greater control of your own health care. In this course, the objective is to help you understand how to pay for your health care. Out-of-pocket expenses are the costs that a member has to pay when they receive medical care. There are 3 types of out-of-pocket expenses. First, there is a yearly deductible. A deductible is a set dollar amount that must be paid before the insurance provider starts sharing the cost of covered medical services. This deductible amount is separate from the monthly premium. For example, if a policy has a $2,000 yearly deductible, you'll have to pay the full price of medical services until this amount has been paid. After which, the insurance provider will start sharing the cost of services until the patient has reached their yearly OOPM, or out-of-pocket maximum. Once the OOPM has been paid in full, the insurance will pay 100% of the medical costs for you. Second, there is a copayment or copay. This is when you pay a set amount for covered services, like $20 for each visit to see your doctor, or $10 for each prescription medicine that is covered by your plan. The third type is a coinsurance. This is similar to a copay, but instead of paying a set amount for covered services, a certain percentage of the cost is calculated and paid. If the coinsurance is 20% and a visit to the doctor costs $125, you would pay $25 for your portion of the visit. If you understand the factors that can affect how much you will pay for medical services, you will most likely be able to reduce your out-of-pocket expenses. One thing to keep in mind is whether or not you have satisfied or reached your yearly deductible. Aside from switching plans, most deductibles restart every January 1st. If little to nothing has been paid towards a deductible, you may want to consider asking the doctor if medical services late in the year can safely wait until January. This way the deductible can be satisfied at the beginning of the year. Another factor to be aware of is making sure you treat with doctors who are in your plan's network. The insurance provider's network is made up of hospitals and doctors who have an agreement with the insurance provider to charge fixed, reduced rates for medical services. Depending on your plan, the insurance provider may not pay for any medical services provided by an out-of-network provider, or they may apply a higher copay or coinsurance. Do your best to see in-network providers whenever possible. You can ask your insurance provider for a list of doctors, mental health care providers, and hospitals within your network. You should also be aware of whether or not the service you are receiving is a covered benefit. Although most plans must now cover the 10 essential health benefits, there are cases when your plan may not cover medical services that seem basic. There may be limitations on certain types of benefits. This is when the plan limits your coverage, for instance, only covering a certain number of visits per year. Pay close attention and make sure you understand any section of your plan documents on limitations. Meeting out-of-pocket maximums, or OOPM, is another factor of your expenses. The OOPM is the most you would have to pay out-of-pocket for medical services each year. Usually the deductible and any copayments or coinsurances count towards the OOPM, but the monthly premium does not. Once the OOPM has been met and paid for the year, the insurance provider will pay 100% of the cost of any covered services. Be familiar with your plan's OOPM. If it is reached before the year is over, the doctor may agree to proceed with any additional or optional services needed. As long as they're covered, you will not have to pay a copay or coinsurance for the rest of the year. Before receiving any tests or treatments, you should make sure you understand exactly what your cost and coverage will be. Here's a list of questions to ask your office and your insurance carrier before proceeding. Have I satisfied my deductible? If not, how much is left? Is my doctor or hospital an in-network provider? Does my plan cover this service and any other services I'll need with it? Are there any limitations to my coverage? How much does my doctor or hospital charge for the services? How much is my copay or coinsurance? If my doctor or hospital is an out-of-network provider, will my insurance cover any of the services? If so, what is my copay or coinsurance? Do I need to get pre-certification from my insurance provider, or a referral from my doctor in order to get these services covered? If you see an in-network provider for covered medical services, the billing and payment process usually works something like this. You see the doctor. The doctor sends a claim to the insurance provider. The claim will include services provided by the doctor along with their costs. The doctor's office may send you a statement, which is not always a bill. This statement will reflect the services provided and how much the doctor billed the insurance provider for each. Based on the type of service performed, whether or not you have satisfied your deductible, and the amount of your copay or coinsurance, the insurance provider pays the doctor for their share of the costs. The insurance provider will then send out an explanation of benefits, or EOB, sometimes called a health benefit statement. This explains how much of the services they paid for, and how much is left over, if any. Any amount left over is what you owe the doctor. An EOB is also not a bill. The doctor sends a bill to you for the leftover amount. If it was not collected in the office at the time of service, you then pay the doctor directly for any amount you owe. Here are some tips to help you with paying your bills. Keep all bills, statements, and EOBs. File them by date in case they need to be found later. Do not pay the doctor until the insurance provider has paid their share. Wait until a bill is received from the doctor showing how much is owed after the insurance provider has paid. Remember that the billing and payment process does not always work the same, depending on who the bill is coming from. The doctor may not send a statement, and the insurance provider may not send an EOB. Call the insurance provider if there are any questions about the amount they paid or the amount you owe. You can also call the billing company of the doctor with billing questions. They usually speak to the insurance carriers at some point to see what is covered and how much to adjust the charges per contractual agreement with the plan. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 5 of this 6-part series on health insurance, and come back for Part 6.